Hello everyone, this is Dr. Nate from Back to Health, and today I'm going to share with you one of our secrets to success. Yes, why we are consistently rated the #1 chiropractic office in the area for your neck and back pain complaints. And the big reason is this: we recognize that we have to be effective and efficient to get you guys the results that you want as patients. It's not enough just to get you out of pain and get you back to doing the things that you love to do, but we have to do it efficiently. We have to do it in the shortest amount of time with the least amount of treatment to maximize your healthcare dollars. And the way that we do that is we rely on two things. The first thing is our background knowledge base and our clinical expertise. If you'd like to review our credentials here at Back to Health for the providers, go to www.getbacktohealth.com and click on our curriculum vitae, and you can review all of our training. But we also use our clinical experience, which is in this office between providers. We've got almost 50 years of clinical experience treating common neck and back pain conditions. But the other thing that we really use to help make healthcare decisions for you is the research. And there is quite a bit of scientific research out there that we read over all the time as it comes out, brand new stuff. We're reading the latest research that helps us guide you through your care path. So when you come into the office and we can identify your problem, we know based off the scientific literature what the most appropriate way is to treat you. And that's what I'm going to share with you here today. Okay, the piece of research that we're going to take a look at today answers this question. It says, does supportive, also known as maintenance care, offer the benefit of preventing relapse and or added improvement? So you should understand when we talk about supportive care in this research, another term for that is called maintenance care. Perhaps you've talked to friends or family members, or you know somebody that uses chiropractic and they say, oh yeah, I go to the chiropractor once a month. That is more of that supportive or maintenance type care to help the body, to support the body in the healing process. The name of this paper is, Does Maintain Spinal Manipulation Therapy for Chronic Non-Specific Low Back Pain Result in Better Long-Term Outcomes? It was published in Spine in August of 2011. First and foremost, again, what is supportive care? Supportive care is the period of care immediately following what we call active care. So you have active care and then you have supportive care. So really, let's define active care. And when you define active care, you have to think about like wound healing. We've all cut ourselves. We know how that generally progresses. You know, step 1, we cut ourselves, we're bleeding profusely. Step 2, the bleeding stops and we start to develop a scab in step 3. And then as that scab continues to heal, scab falls off and you're left kind of with that pink skin. Everything from the point on where you cut yourself and you're bleeding all the way down to where that pink skin kind of develops is what we would consider active care. What happens then is over the next 6 to 12 months, that new pink skin continues to remodel itself, it continues to heal, and it eventually forms like more of a normal flesh-colored skin. Okay? That period of time from where that pink skin is going into normal flesh is what we would define as supportive care. So in a chiropractic or rehab setting, active care, this is where you come in, you've got pain, our goal is to get you out of pain. This is where you come in and you can't sit for more than 5 minutes, you can't stand, you're not sleeping well. We want to get you back into normal function, doing all the things that you love to do. And as we go through this portion of your care, active care, we're seeing you quite frequently to do this relatively. Sometimes we see people daily, 3 times a week, 2 times a week, once a week. We're usually reevaluating you every 30 days to alter your treatment plan to make sure that we're hitting the goals that we want. Remember, the goals of active care are get out of pain and get back to function. But once we got you to a point where you're pretty much pain-free, you're doing all the things that you love to do, there's still a considerable amount of healing that needs to occur. Just like when that pink skin needs to turn into normal flesh, it takes time to do that. What if we provided care during that period of time? Would we get better outcomes? Would we get less risk of a relapse? Would we get actual continued improvement? That's what this research was designed to take a look at. So again, supportive care, you're already feeling good. You're already back to doing your normal activities. But let's continue treatment at once to twice a month during this last final phase of healing of 9 to 12 months. Do we get less relapse? Do we get continued improvement? That's the question that this research aims to answer. Again, using my emojis down here, you can see with active care, this is where you come in with your little tear, you're not feeling great, and we get you feeling good. Usually in our office, depending on what you're dealing with, it can be anywhere from 1 to 3 months of care is about the average. Supportive care, again, you're already feeling good, but can we get you feeling even better? Can we prevent you from having a relapse, essentially wasting your initial investment on active care. So again, the title of the paper is this: Does maintain spinal manipulation therapy for chronic, non-specific low back pain result in better long-term outcomes? Let's take a look at the study design. In this particular study, they had, well, first of all, it's a prospective, single-blinded, placebo-controlled study. Big fancy terms, you don't need to know anything about that. All you need to know is that this study, the way it was designed, is considered to be a highly reliable study. The information we derive from this study is considered to be, very good information. So in this particular study, they took 60 patients that were suffering with chronic low back pain for at least 6 months. They took these 60 patients and they broke them down into 3 groups. The first group got 12 chiropractic treatments over a 4-week period of time, and then they got 0 treatments over the next 9 months. So essentially they got no supportive or no maintenance care. The next group got 12 chiropractic treatments over 4 weeks, and then they got 2 treatments per month over the next 9 months. So group 2 is the group that they actually delivered supportive care or maintenance care to. The third group was 12 fake chiropractic treatments over the next 4 weeks, and then also no supportive care over the next 9 months. And again, this is a control group, and it's put into the study to eliminate the effects of the placebo effect. Again, not something you really need to know about, but just know that this fact that they had these people getting these fake chiropractic treatments, whatever that means, these fake treatments helps eliminate some of the variations that would be maybe contributed to placebo effect. Also, what they did in this study is they did re-examinations. They did them at the 1 month, the 4 month, the 7 month, and the 10 month periods. And then they used what are called outcome measurements. And they did this by using various different tests and surveys that the patients completed. So they used oswestry, visual analog scale for pain, SF-36 to measure quality of life, mobility test, and patient self-evaluation of improvement. Just a side note, it's really great to see pain levels improve, but there's a major shift in healthcare into getting away from focusing only on pain relief, like with painkillers, and getting back into focusing, yes, we want pain relief, but what can we also do to return the patient to function? So in this particular study, they're measuring things like mobility tests, quality of life, and patient self-evaluation of improvement. So let's take a look at the results. I think these results are really interesting and certainly worth reviewing here right now. The first quote: patients in the real chiropractic treatment groups experience significantly lower pain and disability scores than those in the fake chiropractic treatment groups. Okay, so basically the people in the study that were getting real chiropractic treatments, whether they got supportive care or not, compared to those that were getting those fake treatments, actually did a lot better. So, we kind of expected that, but it's good to see that that was actually seen in the research. Only the group that was giving chiropractic treatments during the follow-up care, the follow-up period, so only the group that got the supportive care, got the maintenance care, showed more improvement in pain and disability scores at the 10-month evaluation. So what we can see is those that continue to get supportive care during that last phase of the healing actually showed more improvement in pain and disability scores over a 10-month period of time. They got better long-term results. In the non-maintained chiropractic treatment group, the mean pain and disability scores returned back near to their pre-treatment level. So this is a bit concerning, and we used to think that when patients came in, supportive care or maintenance care was kind of like an optional thing that we would recommend to the patient. And we now know empirically, if your goal as a patient is to basically sustain the gains that you've made, show some continued improvement, and mitigate your risk of relapse, supportive or maintenance care is not really an option. The empirical evidence, the scientific literature is showing us is that people that didn't continue on with some type of supportive care actually had a pretty good tendency of relapsing back into their original complaint as far as pain and disability is concerned. Let's see here. The last quote here was, at the 4 and 7 month evaluations, the mean pain score elevated back toward pre-treatment level in the non-maintained group. However, the pain score in the maintained group continued to improve. So again, building on the last statement where it said that those that didn't get supportive care actually showed a higher tendency of relapsing or going back into their pain complaints. At the 4 and 7 month evaluations, not only were patients that were getting supportive care not retrograding, not seeing their pain levels return, but they were actually showing continued improvement through that supportive care portion of their treatment. Again, it's all about what my patient's goals are. I tend to assume sometimes that the goal is, when you come into my office, is to not only get better, but learn what you have to do and what you can do in order to maximize on your initial investment and basically mitigate the risks of relapse, prevent relapse, and even try to continue to improve and gain more function and gain less pain and gain more ability. I hope you enjoyed the research here. Again, this is Dr. Nate from Back to Health. If you have any questions or concerns about this particular research, your care plan in the office, or really anything about chiropractic, don't hesitate to reach out to me. Have a great day.